morning. Good. All right, I'm Dennis Truong. I'm the Telemedicine Mobility Director for Kaiser Permanente, a Mid-Atlantic Permanente medical group here in DC area. First of all, I have a disclaimer. I actually grew up with a huge fan crush on Kaiser Permanente. Right? I grew up in that way in the sense that I grew up in Northern California, where one of every two members or the population are members. I grew up thinking that healthcare was like this everywhere. Right? So when I started my medical school and residency, I was in Detroit, and quickly I figured out healthcare not like this everywhere. Right? So after that, I joined into the Air Force, and I was a medical doctor in the Air Force. And once again, I think life was a little normal again because it was more standardized. It was a camaraderie, and that's where we first started using telehealth. My first experience with telehealth was using WebEx as a night doctor in order to speak to my colleagues in the States who were surgeons to get some consultation. And that's my first experience with telehealth. And then after that, I actually worked for the VA for a little bit. And I was a fork in the road where I was enamored with the VA system also. It was a great system, and I was at this fork in the road. You join Kaiser, or you join the VA. I think either way, my choice has been amazing. I followed Dr. Loftus here over to Mid-Atlantic, because interestingly, small fact is that I grew up about a mile away from one of the most darling medical centers of Northern California, Kaiser, Santa Clara. So that heavily influenced my decision to come here, and I'm actually just very honored to be in front of you today talking about this. Now, what is the sweet sauce? What is the secret sauce that we have at Kaiser Permanente? It's not about the telehealth, not about the technology. It's about the foundation of our system, right? We value integration, and everything that we do here, all this whole web, is about the integration of our system. It's not the horizontal integration. It's a vertical integration. I think of it like a DNA helix, right? It's like this DNA helix. At the center, the spine, is the patient. And everything we do revolves around that patient. So whether it's technology, whether it's a new department, whether it's a new workflow, it really evolves around how do we deliver patient care better, right? It's like this relentless pursuit of bettering care. And that's what the culture at Kaiser Permanente that I've learned and still carry out to this day. Now, with knowing all the pieces of your Legos, that's how we start thinking about telehealth, which I think, hey, how do I improve the system? We have this innovation opportunities throughout Kaiser. Throughout our 8 regions, we have 21,000 physicians and countless other nurses, right? They all have an opportunity to give input into innovation, including telehealth. With their input, there's a due diligence that happens, right? It's like you're sifting for gold, you're filtering, you're trying to sift through it, and you figure out, what are the good pieces that actually fit into our organization? Not the shimmery, not the shiny, but what fits into bettering patient care. Within all that, like in Mid-Atlantic, we have the opportunity to do that. When you're sitting at your desk, you have a great idea, you got an aha moment, and what I used to do is to write on a little sticky note, and you put it on your monitor, right? Then those sticky notes are accumulating, and it forms a nice little flower around your monitor, right? Here in Mid-Atlantic, what we have is we have a little light bulb right in Health Connect in your EMR system. So when you're sitting there, I have an aha idea, you click that light bulb right away, just put your idea in there. And it submits directly to someone from one of our teams, and then we evaluate, do due diligence from there. So that way the idea didn't get lost. And then we bring that physician or that nurse or whoever submitted the idea back into being the champion of the idea. Because obviously there's some passion, something drove them to submit that idea. So in telehealth, there are many ideas around telehealth right now in our organization that's how it occurred. And luckily for us, we have, being an integrated care delivery system across the country, our 8 regions coordinate and share best practices and meet and have committees in order to take these ideas and make sure that we're doing what's best for the whole system, not just one individual region. And that's one thing I really love about the opportunity at Kaiser Permanente is to be able to share best practices with colleagues and learn from them from other regions. It really makes your learning curve much easier. And one of the ideas that we had was video visits, and I'm going to go ahead and talk about that in a little bit. I know Neil's going to talk about remote monitoring. I'll just talk about video visits in a second here. But first, before you move forward, you got to look at your history. And you look at the trends and what is in your system already, where are you moving toward. Kaiser Permanente has been doing telehealth for about more than 20 years now, in the sense that we started out as thinking as we need patients to have a portal to be able to access the medical records. An idea that wasn't very cool at the time, but it's very cool now, Right? They thought about this well before it became a cool factor. Then after that, we were like, well, what if patients can refill their prescriptions online? What if they can check their lab results online? What if they can email their doctor directly? My dad's a Kaiser member. He loves the emailing part. Yeah, but then other than that, then what if the patients in 2012, what if the patients have a smartphone in their pocket that they can do everything from their phone? Right? All these ideas continue to progress, and then in 2014, that's when we were like, well, what if a patient can see a doctor by video, and that doctor have all the electronic medical records in front of them? So Dr. Loftus talked a little bit about some of the dimensions of telehealth. I was just going to mention briefly what we do here at Kaiser Permanente. We talked about store and forward. That's like PACS system, teleradiology. We do teledermatology here. We talked about mHealth, the patient portal. Our physicians also have Haiku, which they can check patient medical records and take some action from their phones. Over 50% of our physicians in Kaiser Permanente and all the medical groups have a KP-issued iPhone. We talk about remote patient monitoring. We have the ability to monitor patients with remote glucometers, remote CHF monitoring, blood pressure monitoring. That's some of the other projects we have here. But let's talk about video. So with video, it's about two-way interaction between a person, a caregiver, patient or provider, and then the provider by using audio-visual communication. This is live, not asynchronous, like we talked about with store and forward. A couple of ways we do this within Kaiser Permanente is with urgent care, primary care, mental health. A patient can basically go on their portal or go into their handy-dandy app and book an appointment directly. Right? They can also call the call center, and the call center can also book it directly. As far as chronic disease management, our patients can be followed up by their primary care physician or their specialist for follow-up appointments by video, basically saving the patient time and money when they don't have to really come into the clinic every single time. Other innovations we've had here at facility to facility, our PSA specialists here in the Mid-Atlantic, especially, if you bring your child into your pediatrician and there's some diagnosis, maybe they think they have a pediatric neurological disorder, and as a parent, you'd be concerned. And if you're in the outside world, outside of an integrated system, it might take 2 months to get a specialist appointment for a pediatric neurologist. What we're able to do is using telehealth, using site-to-site technology with video, we're able to get you an appointment same day, usually same hour, to the pizza specialist that's in a remote location. Just to get things started, and actually as a parent, that really kind of calms you down knowing that we have a plan in place right now from a diagnosis. We also, some parts of Kaiser Permanente, we have telestroke, where a member may show up to an ER with stroke-like symptoms, and I'm an ER physician, and it's good to know that a neurologist can be on a video with me, kind of my wingman, just to try to help me out, wing woman, help me out when in that moment where it's a little stressful. This person may be having a stroke, you want to make sure that you're not going to give that TPA in the wrong cases. So these are great innovations that we've had here at Kaiser Permanente. So we talked about these sticky note idea. I just want to walk through our sticky note idea when we first started thinking about video visits was we're thinking about more what ifs. You always got to think about the what if. What if you had a patient who was sick at home and they didn't need to come in or they didn't want to come in. And then they went to a handy-dandy app, what they call the call center, and then that patient can get an appointment for a video visit. And here at Kaiser Permanente, there's no copay. So when they get this video visit, they have a technological support. And what if that technological support can just give them a call, courtesy call, and say, hey, are you able to get on okay? Just to make sure there's that red, kind of like that warm handoff to get on. And then what if that patient came on and they see it's a Permanente physician, a physician that knows the medical record, and is able to access a record and it's actionable data. They're able to prescribe, order labs, order radiology, use proactive care. If a patient comes on with me and they do for their mammogram, I can order the mammogram right from a video visit, right? And I can prescribe medicine to any of the Kaiser Permanente facilities or outside. And then follow-up, they can always email us back if they're not getting better. A closed loop of care. And then that idea is what kind of spurred where we are today with video visit part of our telemedicine at Kaiser Permanente. So without further ado, I would like to speak Ms. Trueheart about her experience with video visits here at Kaiser Permanente. You okay?
Yes. Hello, my name is Brenda Trueheart. I'm a Washingtonian. I was with KP, Kaiser Permanente, in the 90s when my kids were young. And I thought it was great because I had had the others, Aetna, Blue Cross Blue Shield, And when I got to Kaiser, it was all in one swoop, fell swoop. With boys, you go in often, they're bleeding here or there. I just go and get taken care of. So I left KP when I changed employers, and then I came back in 2000. And it's very much different now. It is all inclusive. It's very easy. It's life-changing, really, because I'm not one that has a lot of medical problems, but when I do have them, it's very easy, and it's everything I need is right there in one place.
Great, thanks for that. Can you tell us how have you used technology or telehealth within your experience at Kaiser Permanente for?
Telehealth, well, I've used emails to secure emails. I've made appointments online. I've talked to my physicians on the phone. I've used the portal. I order my medicine through use of the portal or the KP Medicine app, if they have their own. I also used remote monitoring. The remote monitoring, I have a device, and every month I have an appointment that's set up, which I don't have to use because the doctor, I can talk to him during that time if I choose, but most of the time I have no need because he monitors not only my use of the device and how I'm doing, but he also monitors my device to make sure it's in working order. And so that is very convenient because I never have to go in. I've used a 24-hour call center to set up, and this is where I met Dr. Truong about 3 weeks ago.
Awesome. So can you tell us a little bit about yourself as far as, I know you're a busy professional woman, and why do you use the modalities rather than go in and see a physician?
Well, actually, I really don't. Going to the doctor is not a favorite thing for me since I think my kids got me out of that. But it saves time. It saves transport. I don't have to go anywhere. I can do it anyway. As long as I have a phone or a computer, I take full advantage of it. It's time saving. I talk to a doctor that knows me. My records are there when I talk to them. In any way that I contact them, my records are there. It's a KP doctor. It saves money. There's no copay. If I were to go someplace else, say if I just went to a regular urgent care, I'd have to pay them, and then I would have to go, if I wasn't with KP, then I would probably more than likely have to go to another doctor afterwards. So it's all the way around. It's time saving, it makes life easy.
Awesome. Would you mind sharing your experience on when you had that condition and you went to the usual, you called the call center, do those things, and then how we met. Can you go through that whole experience, how it was from your end?
I sure will. It was 3 Saturdays ago. Well, on Friday, I had hurt my wrist. Went to bed, it wasn't a big deal. But at night, a lot of times, things get worse. So when I woke up, I woke about 7 o'clock, and it was really stiff. It was hurting. I said, oh, I better go have this looked at. So I called the 24-hour call center. And I asked the lady, I said, I wanted to know which center closest to me was open, nearest to me was open. And so I made an appointment. It wasn't far, it was right down in Manassas. And I made an appointment, I think I had scheduled it. She gave me a choice of times to go in, so I think I said 2 o'clock. So the morning went on, and of course, the wrist got better. It's like, I don't need to go. I don't need to go to the doctor. I'll go and I'll cancel. So when I called her, I told her that my wrist felt better and I wanted to cancel. So she said, She said, how about a video conference? And I had never done that. I said, a video conference? And she told me, she said, it's very easy. You either go on your app or your computer. I'll send you a detailed email on how to check your computer to make sure you have everything. And then you just sign on early. And then I'll have the doctor call you. and he'll call you, and you'll have it. I said, that sounds great. I chose a time, and I think that one was noon, 1 o'clock or so. And so I got an email, and it said, sign on now. So I signed on. I had signed on previously just to make sure I could get on and everything was working correctly on my computer, because I didn't use my phone because I needed the use of my hand. I'm sure he wanted to see that. So when he came on, Dr. Truong came on early, and I was logged on, and it was great because it was face-to-face. It was at, he has a great bedside manner. And so, he told me to, he completely, he examined my hand. The same thing that he would do in the office. If I had gone to see him, he did, and he could tell. And he diagnosed it as a bad sprain. It was just a sprain, and he directed me what to do. He told me he was updating my records, my medical record, and that was it. And if I had any problems, to please just, be sure to call him or email him. It didn't matter. So it was great. It was great. So I am a fan. I'm a fan.
Do you remember during the exam? I mean, for some folks in the room, you might be, well, how can you do an exam over video? What was the sign that we did? Was it?
Oh, he said, just do like that.
Do the bye-bye sign.
Do the bye-bye sign.
She did move her wrist all around. It was
around.
It was
he
great.
Could see everything.
Awesome. So, with your experience, you're kind of in the IT industry too. I understand you do a lot of program management work in the technology industry. What kind of advice can you give us as far as what would you improve on, or what did you really like about the whole experience about getting on for a video visit?
Oh, it was very easy to get on. They even have a app on site that will check my computer for me to make sure everything's there that's needed for the conference. Very easy. Anyone can walk through it, but just in case you haven't, that's why you get on early. And a technician was going to call, but I told her, that's okay. I'm sure it would be fine. As improvements, maybe a way to maybe upload documentation that may be necessary, or you would feel necessary, or I would feel necessary.
We can do that. I'll show you how to do that after.
Oh, you can do that?
Yeah.
Okay.
So, I think Ms. Trueheart brought up a lot of good points about many things that our speaker spoke about today. About, it's really about for integration, especially for me and for our system, and Neil and Dr. Loftus here, our systems it's integrated, and it's important because telehealth becomes a complement of your system. It extends your reach, and extends the patient's reach to you also. And also, she was talking about how the technical assistance, and not just make the technology and just go run with it. Our population still needs a little handhold at the beginning, just like any technology. It's like riding a bike. Once you get used to it, it's really easy, right?
Very easy.
Yeah. I'd like to open the floor for questions, or Dr. This is for Neil first and question after?